This is Dr. Tasha, back with another episode of Dr. Tasha After Dark, honey. We are talking all things menopause. You see these fly ladies here? You will learn why when you see this episode, honey. Strap up, sit down, grab your wine, a pen and paper, and get ready because we are going in. Hey everybody. Okay, so this is Dr. Tasha back with Dr. Tasha After Dark. So this episode we talking all things menopause. At the end of this show, y'all will know all the things. If I know it, you're gonna know it, okay? So get a pen, get ready, get a glass of wine, get entertained, and let's get to the business of it. All right. So let's first start with definitions. It's real interesting. A lot of people think that menopause, perimenopause, it's all postmenopause, it's all different. It really is not. Okay. We call it menopausal syndrome. That's what it is. The difference is in timing, and the timing is based on your period. Now, what does that mean? So perimenopause, it can start, everybody's different. It can start in your late 30s. It can start in your early 40s. Usually by mid to late 40s, you're certainly experiencing it. You just are. And essentially, the average age of menopause is 51. You can go through at 56. You can go through at 49. You can go through at 40. But the average age is 51. So what happens is generally for perimenopause, and we're only talking about peri right now, perimenopause is the stage leading up to menopause, okay? Now, let me be very clear. All the symptoms are the same, whether it's perimenal or post. The symptoms are the same, and we're going to get to those, okay? But you are perimenopausal until you are menopausal. And menopause, y'all ready for this? It's a day. It's one day. How is that possible? So perimenopause, you are perimenopausal until you have had 12 consecutive, and that means 1 month after the other. You have had 12 consecutive months of no periods. No periods. I mean, if you get to month 11 and you have a period, you got to start your count all over again. Okay? But if you get to 12 consecutive months, so if you had your period January 1st of 2023, January 1st of 2024, you are said to be fully menopausal and you should never, ever, ever see a period again. Okay? Now, January 2nd, you are now postmenopause. Did y'all catch that? So peri is up until you have 12 straight months of no bleeding. The day you make it to that 12th month is your menopausal day. It's kind of like an anniversary. It's like one day. The day after that, you are postmenopausal. Once you pass that 365, you should never bleed again. I don't care if it is, well, I did have a slight period a few months ago. It was only a couple of days. It does not matter. If you pass that 12 month, if you bleed again, it is endometrial cancer until proven otherwise. When I say proven otherwise, that means you go to the doctor. They do an ultrasound. They do something called an endometrial biopsy. They get you information to prove that that bleeding was not cancer. Okay? So that's how it goes. So we got perimenopause. Menopause is a day. And then anything after that for years and years and years is postmenopause. Okay? Now, let's talk about the symptoms because they vary. Let me be very clear. Because your mama didn't experience something don't mean you're not going to experience it. You're a whole different person. Okay. Let me be also clear. You may not have every symptom. It doesn't mean you're not fully menopausal because I ain't got every symptom. It does not work like that. Everybody is different. Like I'll say me. Baby, I'm a hot flash girl. I'm a hot flash girl to my heart. Okay. My mama never really had hot flashes. All right. So it is what it is. So let's talk about the symptoms because they vary. And it's widespread. So the first thing I'll say is temperature dysregulation. What does that mean? That means hot flashes and night sweats. They're different. Okay. Hot flashes, you sitting somewhere, you minding your business, and it's like somebody opened up the oven when you making that Thanksgiving turkey, and the heat just hit you out of nowhere. It's like the angels of hell just came up and descended on you. And it's just a heat. And it kind of just goes from like the top of your head all the way down. Like it's just an internal heat. You start sweating under that bra, baby. You don't wear a waist trainer. That's why middle-aged women don't care when they stomach hang up. We can't wear no waist trainer. We can't wear them garments. Baby, I wore one to work one day. Let me tell y'all. I went in the bathroom with some scissors and cut her up, cut her smooth off. I couldn't get all my clothes. I just cut her straight off and threw it right in the trash. I let my stomach hang. It's all right. You don't like it, that's your business, not mine. So temperature dysregulation, night sweats are different. How do they differ? Because it's kind of like that. You're cold, so you throw the blanket on you, and then you get so hot you cannot breathe. You feel like, Lord Jesus, who turned the heat on in June? So you bring one leg from under the cover, then you start freezing. Then you bring that leg back under, and you do it back and forth all night long. It's miserable for your partner. It's actually miserable for you because you kind of can't really even get into a deep sleep. And let's talk about sleep. So sleep is another one. It's either you have difficulty getting to sleep, difficulty falling asleep, or difficulty falling asleep, staying asleep, or really having a good quality of sleep. So it's so funny because it's like every symptom you have kind of leads into the next symptom if you don't understand what you're going through, and you'll kind of come up with an excuse for it. So you'll say, oh, I'm having these hot flashes. That's why I can't sleep. Now it's part of the syndrome. And then you can't sleep. So you say, well, that's why I'm moody. No, well, being moody is also part of the syndrome. So, and it's not necessarily like people say, no, I'm not cursing nobody out. Well, you kind of lose your filter a little bit. When you're younger, strangely enough, the frontal part of your brain, it kind of filters out the foolishness you're not so supposed to say. That's why they say old people don't care what they say. You're right. They don't. That's just how it works. So what happens is you kind of just have less patience for the BS. You don't want to hear. You're like, listen, what are you saying? Like, get to the point. What are you saying? I don't have all day type of a thing. Or more or less like you're just not really for the nonsense. Like you just, it's just like, girl, move around me with that. So whereas before you could listen to the friend who talking about the husband who been doing the same thing for 30 years, baby, it's okay. It's 30 years. We friends. You tolerate it. It's okay. Now you like, girl, let me call you back. Let me call you back. You like, girl, today ain't her day. I ain't got time. That kind of just short, a little bit shorter patience. Okay. And then let's kind of deal with the sex of it before we deal with the physical part of it. So sex is kind of more like you really would not care if you were never touched again. Like you just like, leave me alone. I'm tired. I'm watching my YouTubes. I just got home. It's a million reasons in your mind. You just don't want to have sex. You just don't necessarily want it. And some younger people are like, how could you not want it? It's kind of liken it to you just having your dinner. And then you have, a couple cups of juice with your dinner. And then somebody gives you a donut. You're like, I don't want that. Same difference. Like you just don't want it. You're not against it. You're not upset with anybody. You just don't want it. Doesn't appeal to you. Which is tough because this is kind of like the prime in your life, especially when medicine has developed stuff like Viagra, Cialis, and whatever other drugs they got. These honey poppers they using from the gas station. We'll get into that. All this stuff they have. So the men are on one and you like, ugh. So what I've seen a lot of, and it's not funny, it's really sad because what I've seen a lot of is a lot of women who come in and say they feel like they're in a position that they have to give their husband's permission to have a girlfriend because it's like, I know he wants to have sex, but I just don't. And then when we do, it's painful because you have vaginal dryness. So they're doing what they normally did. And now you have the vaginal dryness. Some women are embarrassed to use lubricants. And I got a trick for that too, so stay tuned. Some women are embarrassed to use lubricants. Some women it's just uncomfortable. And it's like, you ain't fitting to bust my stuff all up, jacking my stuff all up. I feel swollen, I'm bleeding and spot. Too much is going on. You stay over there. And that's a difficult place to be in your life. So on top of the fact that you got all this emotional stuff going on, you physically feel like blah. You don't want to have sex, but you kind of in the back of your mind feel like you have to. And then let's get to the physical part of it. So as we get to menopause and perimenopause and all those things, our body starts to store fat different. Okay. So that whole midsection, I call mine Percy. I've embraced Percy. Percy goes everywhere with me. It is what it is. I could do something about it. I just don't feel like it. So, it is what it is, but you get that midsection. Now we got back fat. Now it's like I'm going to the gym and I can't lose it. And you're right. The body is really, interestingly enough, as your bones start to thin, your fat starts to increase because you got to protect yourself from falls and things like that. So yes, really interestingly, the body is self-protective, but that don't look good and that don't feel good, especially when got that Coke bottle shape from the time you were 20 to the time you were 40. Now you're 45 and something altogether different. You're looking like a Fanta bottle. And it is what it is, and I'm sure your partner doesn't mind, but it has a lot of mental and emotional strain on the woman. So with all this being said, the most difficult part about this is men don't understand it. They don't understand it, and they're like, okay, well, what's the problem? Okay, well, they don't get it, and it literally impacts every component of your life. And for them to be such a big part of your life, and you feel like you're going through a huge change that they just don't get, where does that leave us? Like, what do we do? So one of the big questions that I got was, how long does this even last? Well, it varies because the physical changes like the bone thinning and the increase in cholesterol and the increased risk of all the things. And as you age, the number one risk factor of cancer is age. So as you age, your risk of cancer increases. So all of these things are happening and they don't stop. But when you talk about the hot flashes and the worsening this and the worsening vaginal stuff, all of that goes probably for about anywhere from 10 to 15 years. So it does come to an end, but at the same time, the underlying stuff that you can't see continues to worsen. Okay, so you say, well, what do we do? What do we do? Because strangely enough, although we all kind of are going through it in our own way, women are very hard on each other. We're very hard on each other. And we don't give each other the grace that we should, in the spirit of somebody snap off on you. Well, you know yourself, you have bad days because of whatever it is but you're not going to give sis any grace. I'm going to HR because these environments, these conditions, and a lot of women are finding themselves in a lot of ugly spaces. So we have to figure out how to navigate ourselves and kind of pull back and say, am I in that space today? And I need to give somebody grace. And then we also need to be able to understand when another sister may need grace too. So not only are we dealing with our stuff, we have to figure out how to deal with other sisters who are in the same space, and then figure out how to deal with these men without killing them. Albeit they got the problems that they got, we still love them, and we want to be with them. So what do we do? And that's a heavy burden on women. And I think that people don't pay enough attention to it. So let's talk about it. I think that when it comes to menopause, there's treatment. There's treatment. I know our mamas, Big Mama and them, if they talk to you or you listen to Big Mama, you would be in a space of, well, it's a rite of passage. This is what you got to do. We all went through it. You'll be fine. He'll be fine. And I think a lot of times y'all talk about back in the day when, your mama knew he had that chick on the side. She ain't say nothing. The side chick stayed in her place. She stayed in the project. My daddy paid the rent, took care of them kids. They wasn't never going to come to church. They weren't going to embarrass the family. They weren't going to do none of that. They was going to stay in their place. We was going to stay over here in the suburbs, and everybody was going to be happy. And I think that a lot of this may extend from that, to be perfectly honest. But now side chicks don't stay in their place. They don't stay in their place. Okay. So, main chicks, wives and all that, we got to have some arsenal. Okay. We got to arm ourselves with the armor of God before we go out here and be on the live, 11 Alive news, baby. Because they don't know how to act, and social media got them nutting up thinking they important. So let's talk about what we can do to get in a better place, right? For all of us. Okay, I'm protecting y'all side chicks out here, baby mamas. I'm protecting everybody who act like they ain't got no sense in these streets. So let's talk about this. So when it comes to treatment, and let me just preface this by saying I never do anything for my patients that I would never do for myself, or that I don't necessarily agree with. You can't get me to agree with anything that you can't explain to me makes sense, and that I would do it for myself or my mama or my aunties. So let's start with that. So no, I don't get paid by any companies. No, nobody sponsored this podcast. I'm speaking to you from what I do every day for my patients. A lot of doctors won't sit and take the time to give you the information. Well, I'm giving it to you. You can always refer back to this podcast and take these questions in with you to your own doctor if you're not here in Atlanta. So let's talk about treatment. There are two schools of thought when it comes to treatment. And I'm going to tell you one, I'm just straight up against. I've never done it when it was all that we had. Okay, I did what I had to do, but I've always been against it and I always counseled about it. So the first treatment is what we call synthetic treatment. Now you say, why synthetic? Who would go with synthetic versus natural? Let me explain the synthetic. So anything that happens naturally in nature, anything that your body produces, anything that is produced in the wild, anything that grows on trees, you cannot patent. You cannot patent anything natural, right? So what happens is when it comes to the whole patenting of things and not being able to patent anything natural, drug companies were like, well, how are we going to make this money off of this thing that we can't own it? We can't charge for it. So what they did is they pulled in the natural and they tweaked it. And when they tweak it and you make something synthetic, whenever you add anything synthetic to something natural, you change it and not for the better, right? So we learned that synthetic hormone replacement, although very, very low, it increases your risk of cancers. And what does that mean? That means like your lifetime risk of having breast cancer because you're a woman or a man is 15%. So we know that hormone replacement increases that to 17 to 18%. Well, statistically, that's not significant. But if you have a family history of cancer, if you have a BRCA gene, which is a breast cancer gene, which makes you at increased risk for developing breast and ovarian cancer, if you have that gene and don't know, or if you do have the gene and you do know, or if your mother has the gene, whatever the case may be, none of us are in a position where we're willing to accept any additional risk of cancer for lifestyle. We're just not, right? So it got to a point where, and that's with CNN and all these other news networks, they were like, hormone replacement causes cancer. And everybody was like, oh, nope, don't want it. Sorry, I'm done. I don't want it. And outside of the fact that because it's such a situation where women were living so miserable, they could charge you what they wanted to charge you. So they were charging $200, $300, $400 a month just to get minimal relief. And the relief would really just be from the hot flashes. And anything sexual would take time. And the sexual desire component of it, they wanted to put you on antidepressants. And it's like, bro, I'm not depressed. I'm in menopause. What are you doing? So now you on a medicine to stop the hot flashes, which, okay, it works. But now in your mind, you're scared to death because you worry about this cancer. Now you're on an antidepressant because you go talking about the risk of cancer. They just going to increase your dose of antidepressants. And at the end of the day, all of it takes a long time to work to help with your vaginal lubrication. So now we're using lubricants. And again, for a woman, that plays around with your mind. Man don't really care. He feel what he feel. He don't care what's in there as long as he feel what he feel. But a woman, that's something altogether different. So it just got to a point where women were like, it's not really worth it. It's not worth the money. I'm not really getting the benefit. And maybe my mama was right that this is how I have to live. Right? So then you had a couple of very smart people. I wish it was me. I swear I wish it was me. Because I might not be on this podcast today, y'all. But who said, okay, well, whether you have 4 quarters or whether you have 100 pennies, you got $1, which makes sense. What does that mean? So they said, well, what we can do instead of getting a few women and charging them a lot of money, let's get a lot of women and charge them a little bit of money. And then that way we don't have to have a patent. We don't have to tweak anything and we can give them the best care possible. So you had a couple of companies and one company spinned off of another company. And I'm going to just say, I'm not saying the company because they didn't sponsor me, but one company is a spinoff of another. I love the spinoff company. And I'll tell you why. Again, everything I do, I don't do to my patients without doing it to myself. So a company said, what we can do is we don't have to tweak anything. The estrogen that we need to replace in some women is estradiol. We can just give them straight estradiol. What people don't pay attention to with synthetic hormone, because you couldn't really tweak this too much without changing it into something that just wasn't good, is testosterone, which women don't realize we need it. We have it. Like everything in a woman starts with testosterone and then it gets converted to other hormones. So it's very, very important that you have testosterone. People don't get that. Oh man, I'm going to grow a beard. I'm going to do this. I'm going to do that. No, you're not. And we'll get to that too. So they said we can give you what your body already makes. So there's no allergic reactions, there's no reactions, there's no any of these things, because we're just replacing what your body says it needs. Well, how do we know what your body says it needs? We draw blood. I don't know what the calculation is. Don't ask me. I don't know. I put it in the computer. The computer spits it out and says she needs A, B, C, D. That's it. I wish I was the brains behind it. I'm not. Okay. I pay the people. They let me use their program. And then that tells me what you guys need. Obviously, there's some intellectual stuff that has to go along with it. What symptoms are you having? What symptoms aren't you having? What do we have going on? What's happening? Obviously, there's some medical stuff that has to go on, because y'all went somewhere and tried to open a salon suite and try and treat people menopause. But anyway, the point is that because that's what they do. But the point is that so what we learned was we can help women even better by fixing all of their symptoms and giving them only what their body already produces. So when you have a situation where we're optimizing your hormones, your actual hormones, we're actually decreasing your risk of cancer, and we're decreasing your risk of bone thinning, and we're decreasing your risk of having elevated cholesterol and all the bad things. And your body is now recognizing what you're doing at the gym or what you're doing in efforts of diet. It's not that it makes you lose weight, but it recognizes now, whereas before, I don't care how much you went to the gym. I don't care how many crunches you did. Your body was going to be like, yep, and I'm still gaining 2 pounds. That is the feeling of menopause, and you feel so defeated on so many levels. So if you're experiencing this, you're not alone. If you've yet to experience it, open your ears, because you coming into the club, sis. And so I am a diehard supporter of what we call bioidentical hormone replacement. And that's what I was explaining to you. So patients come in, they explain their symptoms, what they're going through, what their history is, what surgeries they've had, all the 9. And then we draw blood. And people say, well, what did my blood show? That's so rich when I hear people say that. Girl, I don't know. Why? And it's because your blood does not say, oh, you are 2 months away from menopause. It does not. It just says either you're in it or you're not. Well, we know whether you're in it or not, whether you have periods or not. But I don't care whether you're in it, how deep you are in it. If you have the symptoms, you're experiencing menopausal syndrome, and the treatment is the same. Does that make sense? Now, whether you're having a period or not depends on what hormones you get. Okay, but at the end of the day, hormone replacement is what you need if you're having menopausal syndrome. So anybody who says to you, oh, let me draw your blood. Oh, yeah, well, you close to menopause. They're bullshitting you. And just know and understand that that's kind of one of your red flags, to say, well, I thought that you couldn't really tell, because it's a range and the ranges overlap. So if you ever have had your hormone levels checked, ask them, say, can I have a copy of my lab work? And you'll see that the hormone levels overlap. So you could be in this phase of your period, but that's the same range as the postmenopausal range, but this range is normal. It does a whole lot of things. So it doesn't specifically say where you are, and it doesn't specifically say how long you'll be there or how long it'll be before you're menopausal. So don't get pulled into the ropey-dope, okay? But again, so when we talk about treatment, you say, well, how long am I going to have to be in treatment? I can't answer that. But I can tell you what we're about to talk about, y'all, what we're about to do. I have a couple of guests that I want to introduce y'all to. And I thought it was very important to bring guests on, because the bioidentical thing, again, a lot of doctors, if they don't understand it or they don't do it, they'll make it a negative thing, or they'll make it something that they try to scare you to death about. I don't care what you do. And I always tell my patients, I don't care what you do, as long as you do it from an educated perspective. So let me educate you, and then you can do whatever you want to do. But you can never say you didn't know. You can never say you didn't understand. And that's my thing. Like, that's empowerment. As long as you know and understand what you're doing, you can be as ignorant as you want. I'm good with you, sis, and I'm going to rock with you every year. And I'm going to encourage you and love up on you. But you can never say you did not know. Okay? So I think it's important I got 2 different perspectives. One patient is postmenopausal and one patient is perimenopausal. And I'm not going to tell you which one is which. And to be perfectly honest, you probably won't even be able to say. I'm going to tell you, these hormone pellets are Benjamin Buttons. I mean, I'm cute. I've always been cute. It is what it is. My mama told me, and I believe her. But at the end of the day, like if you look back, I just feel like I'm aging backwards. The girl's getting better. And I don't know if I'm looking younger or whether I'm just simply getting better and coming into my own. But yes, I'm on bioidentical hormone replacement. Live by it, love it to death. You say, well, do you go to another doctor? My bestie does it. And let me tell y'all a funny story before we get these ladies on. Not that y'all care, but I haven't had my pellets in about 8 months, right? And so I'm dying, literally dying. But she's going through something right now, so I'm giving her some grace. Giving her some grace because, normally I'd be like, come over to the house because we're both so busy. She's busy in her practice. I'm busy in mine. I don't have time to do it at mine. She doesn't have time to do it at hers. So normally I love to cook. I'll cook something. We'll do each other's pellets and, have a nice sterile area, clean area, do each other's pellets and we good. So I don't drink. It makes me feel bad now. So I don't do it anymore. So cook for her and we're eating, we're talking, she's drinking, So I put her pellets in, lickety split. So she goes to put mine in. She's like, oh, girl, I probably should have did this before I start drinking. I know you damn lying. I said, what? I said, girl. I said, all right. I said, no. So she numbs me up because the way you put pellets in, guys, and I didn't go through this. They go through your butt cheek. Okay, not your booty hole, but your butt cheek. The producer's like, Lord, have mercy. So I numb you up on your butt cheek and then kind of like poke through, put the little instrument in, drop the pellets in, pull the instrument out, put some skin tape on there, put a little pressure, and we good, right? So, and it absorbs over 4 to 6 months. And it lasts for 4 to 6 months. The more active you are, you're going to be closer to 4 months. The more chill you are, I might walk once a week. That's going to last close to the 6 months, okay? I know you're sitting on your behind real bad when you're 6 to 7 months, but whatever. So anyway, back to the story. So she goes to put mine in. So she numbs me up, and y'all know this numbing is a bear. So she numbs me up, and then she's like, ooh. And I'm like, what? She's like, I forgot where I numbed you. I said, I know you damn lying. And then she's like, it's all right. You feel this? I said, hell no. I said, let me tell you what you not going to do. You ain't finna stick me with no scalpel talking about something. You feel this? Yeah, I feel it. She's like, no, you don't. She's like, why your butt take so long to numb? I don't know, sis, but it ain't numb. So we went through that for about a half an hour. Finally, I let her do it. And it was just, I said, that's why it's been 8 months. So I know she's going through some stuff, but I'm traumatized. I'm scared. But normally you will understand why people do not, baby, they do not go there 4 months. And, 3.5, they like, can I book my appointment? And it's because you get addicted to feeling great. But I'm going to let these ladies tell their own story. I'm not telling their story because I want you guys to truly see what good and safe hormone replacement looks like. So we'll be back with our 2 guests. Can't wait for you guys to meet them. So ladies, as we try to live our best life, we have to also try to live our most natural life. And we don't always succeed, but when we can do better, we should do better. I created Clean and Cute out of necessity. Out of necessity for women with skin issues, with itching, with irritation, with women who their panties are not getting clean. All the things, all the issues that women have, each one of these products actually addresses a problem. Our Clean and Cute women's line, it clears the bacteria from women's vaginas onto their panties. It clears the bacteria. The men's line, it helps with jock itch and athlete's feet and the streaky deakies in their underwear. It actually cleans it all out and helps them with general testicular health. This is our Clean and Cute home line. And what this is for, it is for all things home. Your linen, your clothing, your socks, your sheets, everything that is not panties and men underwear, your home will address. For our ladies who want to stay out of danger of vaginitis, but they want to smell good. They want it to smell fresh. We created the Clean and Cute body wash bar. You guys know how I feel about liquid body wash. We created the body wash bar. And for my people with the skin condition called hidradenitis, that it is hell to live with. We see you, we feel you, and we advocate for you. And because there is no treatment, I've created a bar that will help decrease your flares, make them more comfortable, make them less frequent. And we also have a diet plan and a lifestyle plan to go with this soap. So again, every product is designed to address the problem. Every product is all natural and is 5 or less ingredients. From me to you, take a look into it and live your best, healthy, most holistic life. So ladies, for whatever reason, we don't judge. Have you ever come to a space in your life where you needed to lose lubricant, but you hated it? It gets dry, it gets sticky, it causes vaginitis, it makes you have yeast. It just hates your vagina. Well, let me put you on to something. Go to Instagram, officially pleasured XOXO is that girl. First of all, it will not cause a vaginitis. It does not irritate your vagina. It comes with a dropper. So you fill up that dropper, you put it inside the vagina, honey. He won't even know that it's there. It is odorless, colorless, tasteless. He won't even know. And guess what? It doesn't dry up. So if you happen to put it in that night and y'all don't do the bust down until morning, it is still wet, lubricated, and it is not sticky and dry. Run over to officially pleasured XOXO and get you some wet kitty. Why not? So as promised, we are back with my guest. I'm so excited. I love both of these ladies to pieces. First, we have Corliss, and then we have Valor. Okay, so I'm going to let these ladies tell you their journey, what they experienced before they embarked on their bioidentical hormone journey, and just how it is, just the truth about how it is. So I know when people are on camera, they're on shows, they think, don't worry about a sneak attack. We don't do any sneak attacks. I just literally want your perspective. So let's start with you, Corliss, because you're closer to this side. No other reason, okay? Tell me, first of all, you can decide whether you talk about where you are in your menopause journey, but you do suffer from menopausal syndrome. Mm-hmm. And what were you experiencing before your hormone pellets? And when you learned about hormone pellets, like what were your thoughts? And then we'll delve into what happened after.
Thank you for having me. So the first 10 years, I didn't know I needed pellets. I didn't know I was in menopause. Like, let me just be honest, I had no idea. I just thought for the last 10 or 15 years, I was just being a bitch, and that's just who I was. And everybody accepted if that's who I was. And wow. Shows up, and that is just who she is. Wow. All vodka, all tequila, all whatever, no taste it. You're going to get it raw every time. Wow. And it was not, and I remember having a conversation with my aunt, and she was just going on and on about her life. They changed it, and I'm decided, yeah, okay.
So your aunt was taking.
Wow, okay. I'm like, all right, yeah, okay. There's a girl, no, is it, brother? Okay. I made an appointment, and I remember the first meeting I had with you when I came into the office. And I told you that, I shared with you that I had a hysterectomy when I was 75. And we were thinking, and you're right, oh, baby, we had paused your whole life. I was immediately offended.
Really?
This bitch so no, you should have got coming in my outfit. This shit telling me I'm in menopause. You diagnosed me just by what I told you. Mm-hmm. But then as we started to have that conversation about what I've been experiencing, what had changed, how I was sad. And I go into all of these doctors now that have been all of, I got a million. I could give off some of my antidepressants to people like I could start prescribing because I had so many. Mm-hmm. There was the sadness, there was just the feelings of being unwell, fatigued, tired, just not motivated. Like, what is the bare minimum I can do to get into this day? And what do I absolutely have to do that I don't have to do does I do? And then I'm just gonna give this shit. Like, no, I was just unpleasant to be around. And I had been in this space for so long, it was who I was. That was who I was showing up every day.
Wow. And so, and what made the difference for you? Because you said your aunt had introduced you to it, but you were like, I'm not hearing that.
What made the difference for you? What made you say, it might be something to this? To be honest, it was you told me that I could be different. It was, you don't have to be like this. You don't have to experience it. You don't have to wake up sad. You don't have to wake up on edge. Or like, you don't have to go through life. Because that's what I felt like. I felt like, not that I was on vice, the downest tenth, I could never be free. I could never just, I am breathing very shallow, I am not enjoying life. I am just going through it. And the problem that I had was I spoke into Gordon that it all the year pause, or in your pause. Oh, I know. Oh, I know. No, I didn't have that. And it was never, it was a very closed off conversation. Nobody was ever forthcoming about their experiences, about what could be happening. And for me, I didn't want to endure my life like that another 5 years, another year to be honest, like, because I was unhappy. It was a burden carrying all of it, like showing up like that. It was weight. And you said, just listen. If it don't work, then it just don't work. But you owe it to yourself to give yourself the opportunity to fly. Right. And that's it was wonderful. Wonderful. I'm so glad it's, I'm very direct. Y'all know I'm very direct, but I try to always be in a space to speak life into people, because you don't really understand the one or two words that you say that somebody's going to grab onto, and that's positive or negative. So I'm direct, but I try and keep that in a space of always being positive, or always being in the affirmative, of breathing life into people. And hey, listen, nobody's perfect. I ain't gonna say I always am, successful, but it's what I try to do. So, cool. So we got you in. You said, I'm gonna trust this lady. I'm gonna trust this lady, and I'm gonna do these pellets. And so pellet day comes, okay? And you hear the clink clanking of the instruments, and I'm sure you were terrified. Please tell these people, like, how did the process go? Like, was it as scary? Like, talk to me. The vision that I had conjured myself of what this experience is going to be like did not match my actual experience. It is vastly different. So I assumed, not strapped to the bed, but just like, because I did not know where it was going to go. Because it's like, I was going to hit, and I hit my foot. And then, so in my mind, I tried to reconcile medically what this experience is going to look like. And so I came in, and so then, and there was a whole thing, what do I dress? What do I need to put on? Like, do I wear a dress? Do I wear pants? Do I wear, like, so there's this whole thing, because I'm about to have a procedure, and I have no idea what to expect. So I found the loosest pants I could find with elastic, because I was not going to put on something with a button. I just did not know. Okay, so this was not prepared. And I remember coming in, and I cannot, and I don't ever want you to move away from how disarming doing you naturally are. Like, you have this uncanny ability to just put things in perspective and at ease, and all of the, this is about to, like, I'm going to be about to hear, like, I don't even know. He was like, girl, what are you worried about? Like, let's do this. Let's do this. And I'm like, she feel real sure on all this thing. Like, I'm net new. She doing it every 2 minutes. So, but it was what I imagined it being a long time. Leave it have to be the rest of the day off work. I'm blocked out on my calendar. I'm off work. It might have been 7 minutes. And I was like, he's like, all right, you can go. I didn't go where, like, I don't have to stay here for an hour, like, while you watching me, like, because I just wasn't prepared, like, because it's this thing, like, something just got inserted in me. I don't know what to expect, right? Like, do I need to be watched for an hour? It could have been allergic, it could have been anything, right? Should I drive? No. Can I drive? Am I safe to drive all the way back home to Atlanta, Texas, right? It was. So you thought you was having a whole search. Oh, absolutely. That is funny. But I'm glad to hear that. You know why? Because talking to people, it really does alter how I govern the practice. So I think when I have patients who are like, oh, I'm interested in hormone therapy, you guys get a folder from the beginning. I'm like, read, learn, then come in with all the questions you have.
And then you're going to still do another application. And then I'm sure you're going to still have more questions then. And then we're going to sit and talk for a while before we put the pellets in. So there's never a time in which you guys, what? But at the end of the day, I may type up and have things to prepare for your day. Because people just don't know. And for me, like I said, it's a 5-minute procedure. And 7, if you've been through it before, zip, it ain't even taking 5. But I'm going to be a little bit more gingerly if it's your first time, and we're going to go a little. So the thing is that so people are not scared to death with something that they truly don't understand. You see how talking breeds new processes? I listen to y'all. Okay, just real quick. If I had to compare it to something, my Pepsi year had been worst. Not with me though. Not with you. I say. Oh, let me just we all right. No, okay. But but if you think about what you go through with that, just in general, yeah. Having the pellets inserted was so much. It was. Yeah, it's not like I tell people the worst part is the numbing stuff because one, I hate needles. But then when you get numbed, it burns a little bit. Once that 30-second burn is over, you feel nothing else. If you feel something else, that's problematic. So you feel nothing else, and that's pretty much it. For all intents and purposes, it is not a long or difficult process or procedure. It is not painful. It's scary only in that you don't know what to expect, but it is not a scary process or procedure. So you got your pellets in. How long does it take before you feel a difference? And give me the differences. Talk to me.
So I'll be honest. I was expecting this light switch, and I'm going to be different, right? Like I was not expecting it to be, I'm going to be gradual, but I expected it to be a quick gradual. Like, I did not notice anything. The first notice came from my husband. I was a little assiduous. I was a little more calm, a little more gracious, a little more gentle in my speech. I wasn't as assertive. It was, I'm breathing. I started breathing and she started noticing. So people around me, even people at my job, noticed the difference in me before I recognized it. I said, "You're anything. That's what he gets about it. Different." And there's nothing different because nobody knew. Of course, nobody knew. So I was not expecting it to be perceived externally. For I expected that change to be internal. For me to notice it, and then I would be with the people, and then I would be my jets with the people, right? Because now I feel better. Right. I wasn't feeling no good, but I was projecting with it, and that made all the difference. And I'm like, okay, there may be something to this. Now I was not full transparency, that was not feeling the way that my aunt felt, but I also recognized that the second thing, a follow-up that needs to happen. Yes. Once I got that follow-up, I was 25. Living your best life. So y'all, the follow-up she's talking about is after I do the hormone replacement, I have you come in 4 weeks. And what that says is, it says this is where she started. This is what we gave her, and this is where she is. And again, that computer program will spit out and says, nope, she needs more, she's not optimal. And it'll tell me what more to give, or nope, she doesn't need anything more, she's optimal. And so, and that is free, that comes along with it. A lot of offices won't do it because it's free. But it's free. Them people told me to give it to y'all, I give it to y'all. I ain't trying to hold nothing back. I want my patients to have the best experience. So I called her up and said, hey, listen, you need a little bit more hormone from where you was, sister. But she was down there now. And so we had to give her a little bit more. So when she says that she came back, which we call a boost, when she came back for her boost and she got optimized, then she noticed a change. What was the change that you noticed? I was sleeping in bed. In fact, my hunger cravings changed. Just having food that I wanted, because I ate about some noodles and be all right. Like I was all on the sugar because it was about getting through it. Do anything. It wasn't about being healthy. It's like, what do I need to get through to the next day or to the next day? So my eating habits changed. I was not nearly as crabby when I woke up anymore. Like I was excited to wake up for the day. I was excited to look for what was happening. I'm gonna be honest. This is the After Dark show. So I'm be honest, please. After my boost, I started having my first wet dreams ever. Really? Ever. Not ever. Ever. When I say it was like, and I could not get enough of my husband. could not. Where before it was, I could take it or leave it. And if we don't never have sex again, we good. Like, I'm good. Like, I won't miss out. Like, we good. I don't feel obligated on my behalf. Like, don't use me even as a factor in the equation. But the other side of it was, oh my God, I know him. Like, I want him to hold me. I want him to sex me. I want all of that did not matter before was now for me a part of the equation. It was like, I need that. Like, and not only do I need it, I want it.
And so they're the things that not just the sex, like you realize that you missed the intimacy.
It was the intimacy, yeah.
Right.
I mean, and even just, it revolutionized our relationship.
Yeah.
Like from that point on. And it's just, and I had to admit that something was wrong. And that it was that I wasn't stuck in this way. Like, right? Like, so often, even when my grandmother, I remember my grandmother saying she never wanted to get old because old people were mean. I can remember, like, this is just my line in life. I'm just going to be this way. I'm just going to be Cruella de Vil the rest of my life, and y'all do not have to deal with it. Right? Now it's like, that, but yeah, that.
And that's the thing, when you know better, and that's my job, to help you know better. And you decide whether you want to do better. Now, everybody ain't ready, but, you know, at least you know. Okay, so Valerie, my girl Valerie. Okay, so I guess the same questions before. How did you learn about bioidentical hormone replacement? And what made you say, I'll try this. Let's see if this is for me.
But first of all, thank you for having me on the show.
Absolutely.
And thank you for discussing this topic, because this is one that needs to be discussed in the salons, when we are in mom and kitchen cooking around now, or the other team. They call it just going through change.
Right.
They do. But I'm glad you're having this topic, and I thank you. So I just say that my journey to getting to where I am today was pure hell. And the peri, I call it peri at the children, menopause. Because I suffered about 5 years in that stage. I mean, like the Roman Catholics say it, the definition referred to it as long suffering. So I suffered through that. And 10 months, oh, here come ebb flow. 11 months, here come ebb flow. Got through it, finally, got to the second. And then, like he said, it just happened. But what else happened? The night sweats. The ears to do with don't walk. Nobody touched it. Libido went down. Then, got through that. And went to house. And I saw an ad with paper in a magazine. This was a softball magazine with your picture. Oh, is this? She was cool. I love her name. I mean, it was too Dr. Tasha. You wasn't too far from my home. And I went into your office and I saw this sign with this lady, her hair all over her head. And she says, are you having brain fog? Are you having can't sleep, weight gain? Are you irritable, depression? So that is me. That lady on that wall is me. And I said, who's been your office assistant? I said, what is this? She said, you need to talk to Dr. Rogers and tell her what you have and tell her you got all of them. I said, oh my goodness. So I went into your office and I was like, what? How can you fix this? I've been having this for years. And I'm tired of it. It's ruining my marriage. It's ruining everything. I was about to leave me a few times trying to get myself together and talking about the antidepressants. I had a drawer full. You niggas telling me it's all mental. No, I knew there was something going on. And the role, yes, everything. After we discussed it, you told me about it. You said, read this. And I'm like, HOT, that causes cancer. No. Dr. Rogers and Valerie, read this. And then come back and see. So we did everything. And I'm still trying to ask questions. I don't know what I came in there for. I just wanted to get rid of all of that was on that wall. And she said, I want you to go and read it, educate yourself. Do some research, it's online. And then let me know what you think. I made in the 4th year, I came back, and I said, I'm ready. Done all my research, and you had to take the blood. And she said, I'll give you a call in about 3 days. And Terrell just called me and says, how are you living? How do you function? You've got 0.00010 estrogen in your high. Let's not even talk about testosterone. I said,
It is what it is.
can you fix me? She said, yes. So that was the first time. And I wasn't thinking about pain. If it's painful, I'm going to deal with it because what I'm dealing with is more painful.
Right.
So give it to me. Let's do this. And we did it. And I have not looked back. It's been over a year. So as you can tell, I am the menopausal woman. I'm the post one. I read through it all. And I just like to stay in my life. I have so much vitality. I used to go to bed and my kids made fun of me as well as my husband, 7:30, 8:30, and didn't want to get out of the bed. Like, honey, I looked till 10:30 at night, 11 o'clock, just to know what's going on with you, mama. And I mean, really, I think a little bit before the boost, I was stolen it maybe 3 weeks saying I could build a difference. But when I got my boost, I was on fire.
So that boost is setting y'all off. Now everybody be calling like, do I need a boost? Do I need a boost? Nah, I see why. I'm just gonna give everybody a boost. Come on, get your boost.
I told her one time, I said, can we just forget all that? Give me what I'm supposed to get.
That was she said. We give you an extra. We give you an extra one to get it. Lord have mercy. This thing got me changing the whole place.
Give it all to me.
Yeah, it's it really is. And the bad part is you don't get it unless you've experienced it. Nobody can really explain it to you. Nobody can make you truly see like how different. And the thing is that you feel great, but you're like, I can't believe I was living like that. I can't believe I was going every day like that, because you're just surviving, you're just maintaining, you're not really living.
I was saying we're not living, you're existing.
Exactly. And that's the good.
Yeah, until the next day. Like,
Just
I'm
look at
just
that.
existing. Like, so it's literally day to day, moment to moment. You don't make long term plans. This is like, it is existing. It's not even surviving, it is existing.
And the funny thing is, it's hilarious because I had a patient's husband come in, and I'm very funny about talking to her, like not about hormone replacement. We'll get to that because I love talking about hormone replacement, but I'm very funny about talking to husbands. I don't know, patients think that I keep your whole history in the front of my mind. I don't. I gotta pull it up on the computer and be like, okay. I don't. So I don't know who I diagnosed or what. I don't know what happened. I don't know what kind of conversation we had. I don't know. So when they're like, oh, Dr. Barger, such and such, your husband want to talk to you. I'm like, what do you want to talk to me for? Is he out there loading his gun? What do you want to talk to me for? I'm like, oh, damn. I'm like, all right. So anyway, this is a patient who is on hormone replacement. And so he was like, can you drop it down a dose? I mean, I got to go to work. I'm here to pay for it. I said, I bet you are. He said, I'm here to pay for it, but I just need it. Can you bring it down some? I said, baby, I got to give her what it says that she should have. I can't do that. He's like, well, I got to go to work. Okay, what you want from me? I said, well, you know we do males as well. So I'm not going to get into that too much, but yes, there is a male menopause. It's called andropause. Males are a little bit different. They don't have hot flashes, but they do have mood disturbance. They have muscle wasting. You know how they say you got the dad body? That's why. So they have muscle wasting. They have, they just kind of look, they get tired, they get fatigued, they get listless and disinterested. They can even kind of go through a little bit of a depression. Their erections are not as readily as they used to be, and they're not as firm as they used to be if they're able to get erections. And so a lot of times we go to the doctor to test their testosterone, and they're like, oh, it's 300 or 400, you're good. Well, that range is a range. It is not where it's necessarily supposed to be, but we know that males function best when their testosterone is around 1200. So if you go to your doctor and they say 300, well, although it's not terribly abnormal, it's not you living your best life, and you're likely suffering from male menopause. So if you are a female and you're noticing that you're getting your pellets, and it's just like, honey, keep up. Well, are they going through andropause, and you need to give them some grace, and just be able to see, hey, maybe he's going through a thing too. You know, let's get him checked out and see if this is something that I thank you ladies for coming on the show. I appreciate you. I appreciate you sharing your experience. And I'm so glad and so honored that you trusted me and that you continue to trust me, and that you were a part of the record. So I love you guys in business, and you guys can see from my faces showing up and being honest about their experiences that what you see is what you get.
Love that about you.
And I appreciate y'all. I love y'all to pieces, to respect you to the end of both of you. All right, guys. So I hope you learned everything you need to know. We hit them in a little bit, but this ain't their show. So I hit them a little bit about the andropause, but hopefully you know everything you need to know about menopause. If you're not in Atlanta, you know what questions to ask. Again, it is bioidentical hormone replacement. And I hope that if this is something that can benefit you, that you take that step, overstep the fear, and get the education so that you can live your best life. So until the next